Here. And everybody.
Yes,
Okay,
I can hear you.
fantastic. Is it loud enough?
Yes.
Awesome. Thank you.
Hearing you just fine, Doc.
Very good. Is everybody doing okay today? Let me go ahead and share my
Yes.
screen.
Not unmute. Mute yourself, honey.
Your
Thank you.
video's not showing, but that's okay, I guess.
I just unmuted that.
Unless you're up here.
Can you guys see my slides here?
Not yet.
I cannot.
Yeah, okay. Sorry, this is the first time we're attempting this, so let me
There you are.
power through this here. Let's see. How about that?
There you
Yep.
go.
Yes.
Very good. Well, thanks everybody for coming today. And this is our first rendition of Here Together with myself, Dr. Ryan Hill. We're just trying to, spread the word on some more information about hearing aids and hearing loss and
Tell you
tinnitus.
will not be heard. Right
And
now you're live.
and also to answer any questions we may have at the end of this. So I'm Dr. Ryan Hill.
Don't unmute.
And I'm the owner of the Hill Hear Better Clinic, as most of you know. I have a doctorate degree in audiology from the University of Cincinnati. I also have a bachelor's degree in speech and hearing science from the Ohio State University. I'm a fellow of the American Academy of Audiology, and I'm certified by the American Board of Audiology. And I'm also certified to do Veterans Evaluation Services Program or evaluations. So that is about me. Our mission here at the Hill Hear Better Clinic is to give each patient the best hearing possible. And our values include a patient-centered experience, which is making sure that patients are getting everything they need, innovative care, which lets us or is stating that we are trying to stay on top of all the latest and greatest technology, whether it be for hearing treatment, for testing the treatment devices, anything that we can do to be on top of the latest and greatest, we will do. As far as collaborative team goes, we collaborate together again to help our patients get the best hearing possible between our offices, our staff, anybody else we can reach out to guarantee those results. And we like to acquire personal connections with our patients too. This is about science and treatment of hearing loss and tinnitus or tinnitus, but the personal connections are often the most rewarding for us. So we really enjoy that. Let's see. So after our meeting here today, we'll be able to help answer some questions for you. And some of those could be, what are your concerns about hearing loss? Or also, what are some of your questions about hearing loss or tinnitus? We're going to give a short presentation here about some hearing loss and tinnitus topics. And we will then be answering any questions we have as just kind of an open forum for discussion. Let's see. So let me just go ahead and start off. And this is about why constant treatment is necessary for hearing loss. First of all, it reduces the overall strain that your brain has to listen, because we help to maintain and establish the neural networks inside the brain that are responsible for collecting and processing and transmitting data, or that electrical impulse or neurological impulses around the brain. So when we have hearing loss, it's untreated or undertreated, those networks become disrupted. The brain will transmit that energy somewhere else, which gives more meaningful stimulation, which in turn reduces the activation in the hearing portion, but in turn increases activation in other areas and increases the strain on hearing, and trying to figure out what was said, processing. So by constantly wearing treatment devices or treating your hearing loss the way that it's been prescribed for you, we can help to reorganize the auditory pathways back to their designed position. So we re-stimulate the brain in those particular areas, which is called the temporal lobe inside each side of our brain. So both sides of our brain have the temporal lobe, and we're helping to activate those particular networks again and fully to their fullest potential. Hearing loss does not provide that constant stimulation that we need. We also look at constant treatment for giving shorter adaptation periods. If you're just getting started with new technology to begin with, you're a first-time user or even returning users of technology, if you wear the devices full time, you'll be more easily acclimated to the new sound through the new devices if you just make a consistent and constant effort at that. It will also help you to have the ability to be more actively engaged in conversations. So if in noise, you're more able to block out those extraneous sounds because you've learned to listen to them through your new devices all the time. The brain does a very good job of really separating speech and noise. And for some of us, it doesn't as well anymore. But the more you wear your device, the more you are consistently listening and your brain is making adaptations on its own. Then coupled with the technology, it gives you the best chance of hearing in those situations. So if you're in a restaurant, you're out to eat with several people, that you can be a part of the conversation and not have to sit out. It will also strengthen your ability to respond to what is being said rather than trying to figure out what was being said. We find that patients strain to hear. When they strain to hear, that we are seeing more, difficulty actively participating in conversations because they're just trying to figure out what was said, and rather than hearing it the first time and being able to respond, they start to get behind and remove themselves.
Hey, Dr. Ryan, it sounds like your sound is going out a little bit. Can you remember how you adjusted the speaker the last time?
Let's see, does this help a little bit?
Yes, that's a lot better.
Any different here?
That's
No,
really
I'm
a
not
lot
getting
better.
anything.
Quite a bit different.
Yeah, that's really good. And then I was wondering if there were any questions about the last, can you go back one just to see if anybody had any questions about the last slide
Yeah,
or comments?
that's a lot louder now. Yeah.
That's better here.
No, we can't hear you again. We could hear you whenever you were just not using your headsets, I think.
Okay.
You can hear me okay here?
Yeah, perfect.
Yes. No, I
That's
can't hear
best.
you though.
Can you hear us now? Can you hear us now?
Let me see.
Nope. Yeah. Huh. That's crazy.
I think the part of the issue may be that when the doctor wears his headset, he can hear us. But when he does not wear his headset, he may be getting feedback by using the speakers along with his microphone.
Is this any better here?
Yes.
Okay. I can hear you guys okay. It's just not as good, but that's fine. I can make up, or I can,
Maybe you need some hearing aids.
no, I just need a better headset.
I wonder why that decreases your voice on that. That's crazy. Yeah.
Yeah, it's just a bad mic, I guess. But this is okay here. This is better.
Yes, it is.
Awesome. So did anybody have any questions about why constant treatment is necessary?
No, I'm glad we're getting treatment so we can hear what you're saying. You're dealing with a bunch of people that can't hear, doctor.
We pretty much
very
missed
good.
the whole thing.
Yeah.
Very good.
He said it the sophisticated way, but basically, if you're not hearing, a lot of times there's 3 stages. First, you say, huh, what, pardon me. Second stage is you second guess, and 50% of the time you're going to guess wrong. So you'll get something screwed up, someone will laugh at you or get mad. The third stage is you withdraw, and that's when all these other technical things happen. The brain weakens, and it's like a muscle. the more you use it, the stronger it is. You use your right arm, it's nice and fit and firm and full function. Don't use your left arm and it gets weak and it atrophies. And so once you get your hearing aids, it's like 5 weeks before you can reestablish a new neural pathway and stimulate areas of the brain that haven't been stimulated in a long time. He said it much nicer than I did, but I like to simplify things for me.
Well, that was a very succinct summary. Thanks.
You're welcome.
Dr. Michael Hill, the founder of Hill Hear Better Clinic. All right, so let's move on. So how your hearing and brain are linked. So we know that 40% of our hearing is actually just our ears collecting the sound, and 60% of our hearing is what your brain does with that sound. So our ears collect it and the brain makes sense of that particular information. So we know that certain things are linked, like cognitive function and memory, because the brain makes the hearing loss, or because hearing loss makes the brain work harder. It forces it to strain and then fill in the gaps, so we do not have as much time to spend on memory. So this is leaving other energy, or leaves less energy for other thinking and memory systems and overall cognitive function. We know that memory can contribute to the symptoms relating to dementia. So sometimes it's worthwhile for patients or families of patients who suspect that dementia might be a factor to actually get a hearing test first, because some of those symptoms can actually just be disguised by the hearing loss, or hearing loss might seem that way, but really the person is just having trouble hearing and cannot respond correctly because of what Dr. Mike said here just a few minutes ago. So like I said earlier, rather than committing some of this information to memory, you have to figure out what was said, what was there. By the time you figure it out, others have moved on. With decision making, again, rather than spending time or being fast enough to make a decision to begin with, you have to dedicate more energy to figuring out what was said. So your decision-making time is much slower, or hearing what sound might have been. For instance, a car that was passing by. Maybe you didn't recognize it as a car because it wasn't loud enough for you. It also is going to require further coordination with other parts of our brain, like vision, which slows down the normal processing pathways that are responsible. With vision, we found that in functional MRI studies, so imaging of the brain and activation portions of that brain, is that normally we have this higher activation, this bigger portion of the brain for hearing that's activated, but with hearing loss, that portion is now shrinking and it's moving on to different areas like the visual cortex. Inside that occipital lobe, we'll see a higher activation. So that activation is growing, and a bigger portion of that is responsible for helping us to actually hear or try to decide what was said, because of things like lip reading and reading body cues, and all of those types of information, mannerisms, you name it, just to try to figure out what was said. So we're pulling information away from where it needs to be processed and putting it in other forms, which actually puts a higher strain on the brain, and also increases the time it makes to make a decision, or takes to make a decision. We also know that untreated hearing loss can affect speech recognition. So it contributes to less neural activity where the brain processes particular frequencies and sounds that help us to recognize speech. Again, if it's like a muscle, if you don't use it, you might lose it. Any questions on this portion, or can we make that a little bit more succinct?
So hearing aids, hearing treatment is one of the few things that can help to kind of slow down the process. It's not going to eliminate it, but it's one of the few things you can do to be proactive.
Very good. So on the other part of our conversation today, or our little presentation here, is about tinnitus or tinnitus. You can say it either way, doesn't really matter which way, they're both correct.
Hey, Dr. Hill, I think you need to go back one.
Back one. Did I miss one? Oh, yeah, you're right. We missed one. So what is tinnitus or tinnitus? So it's a symptom of sensory and or neurological damage inside the inner ear. This essentially causes the brain to hear its own internal neurological energy. So usually the brain is being fed that outside stimulation from the ear. And we have signals that go to the brain. There are also signals that come from the brain back to the ear to make certain reflexive changes, or to help filter out noise in certain situations, or to help protect the ear when it's very loud. But what happens is with this neurological damage, the brain is not receiving these signals from the outside. While it's sending signals back down, it's not getting covered up with the outside stimulation. Therefore, its signal that gets sent down is returned back to the brain, and the brain hears itself. It's essentially an internal feedback loop, and it's hearing its own neural energy. That's one of the main theories. And one of the things one of the parallels that we often compare it to could be phantom limb syndrome. Somebody might get one of their limbs amputated, but they can still feel that limb there for several weeks, maybe months, sometimes years after it's gone away, because that processing network inside the brain was so strong for that incoming information that it may actually be able to fill it back in, or feels like it's there by filling it back in. We also see a misfiring of neurons inside the inner ear due to damage, chemicals, stress, or lots of other factors. So these cells might not be fully damaged and operating on a limited capacity, which cause an irregular pattern of the neurological firing. Each neuron in our brain and in our body has a particular rate as which it fires by, and how it tells that stimulus is that we have a higher either rate of response, a lower rate of response, or just an increase in the, essentially for sound, an increase in the volume at that particular rate. So it's a larger strike on a drum, essentially, not your eardrum, but if you just think of a constant tapping, it would be a larger one at that particular rate. But in a quiet situation, the brain can quiet that information if it's regular. But what happens if we have a misfiring, instead of a constant tick, 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 if it's a tick, 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 and it's totally different than what the brain is expecting, it will think that there is actually an external stimulus and start to actually process that as a sound. So if we're not getting quieted, you hear that particular sound. So how can it be helped? Well, we need to treat the underlying condition of the damaged sensory and neural cells by providing the brain with the stimulation that it expects. We can help actually reestablish, reorganize, and reinvigorate the neural connections that are responsible for the tinnitus, and help them get back into that homeostasis. We can re-exercise it just like you can retrain that muscle. And you do that, again, just by the constant treatment with your hearing devices. It's just as easy as that for a lot of people. If that particular form and just that stimulus alone is still not, fully helping your tinnitus or tinnitus, we look at a treatment called habituation. So if the overall treatment, which is usually about 70% effective in most patients at reducing tinnitus or tinnitus, if that is not working, we look at this more therapeutic response, which helps the brain habituate to the new sound. We train the brain to quiet the noise by introducing another sound into the ear that is not in your daily environment, and the brain will eventually assimilate the two sounds together. It is called tinnitus retraining therapy. That's about 30% effective in most cases. So it's approved by the FDA. It's not quite as strong, but coupled with treatment for hearing loss, again, we can see a reduction at 30% of patients.
Some of this tinnitus retraining actually works to slow down your heart rate and reduce stress. So there's really nothing directly to get rid of that tinnitus. And little trivia, in the Old Testament, they talk about ringing in the ears. So as long as man's been around, there's been tinnitus or tinnitus. So I find that kind of fascinating. I will shut up now.
So the other thing you can
Fun
do is
facts.
avoid the trigger of what, or you can avoid triggers. So it'd be substances like caffeine, nicotine, alcohol, certain medications, and loud noise, which can cause spikes. I know for me that if I drink too much caffeine, it's pretty hard to do these days, but if I have a shot of espresso in my coffee and I drink it in half the time I normally do, I will have a ringing for about an hour in just one of my ears. It just happens, so I learned to avoid that so it doesn't.
Hey, quick question.
Sure.
Dr. Mike there said that in the Old Testament it mentions ringing in the ear. I would love to find out where. I would be curious about that. If you want to share that, that'll be great. Later on, not now.
I wish I could. I have no idea. I just heard it before. I'm not sure what part, and I would like to find it too if you find it, but I really don't know.
Yeah, that would be fascinating.
Yeah.
If there was a digital copy, it would be easy to find.
I'll check it out for sure.
Yeah. So then the last stage for patients, and these are patients that are severely bothered, is called cognitive behavioral therapy. This is just to help limit and replace negative responses to the tinnitus. So it's retraining yourself to think differently about the issue, that it's not all negative, that you're still alive, that we're here, we're functioning, it's just part of who you are. But that's again for patients that are severely bothered by it. We probably see one or two of those in a whole year of our time here.
Are you talking about the ability to just learn to ignore it?
So sort of, and it's not necessarily even ignoring it, but changing the way that you are responding to it. So instead of saying, oh, this is awful, this is terrible, you just say that, I mean, this is very, very simplified. But it would be, okay, it's here, but guess what? The rest of me is functioning fine. My arm's working okay. I can still taste this great food. I have a great plan for the rest of my day today. So it's just changing how you respond to the overall sound that you're hearing. And it's tough to do, but some patients really need it.
I've been doing this for 44 years. And when I started my business here, I was working on my PhD. Ryan was 3. We had his sister, and my wife got a job, second shift at Children's Hospital, which is a big pay increase. I was drinking caffeine, staying up all night, and I had this ringing, and you know what? It's persisted, but the human body is just amazing. Like usually within a year, you can learn on your own to put it out of your mind. And most people, they just need to be reassured that it's not pathological. It's not going to kill you. And there's only time you have to worry about it is if it's what we call pulsatile. It goes with your heart rate. And that could be indicative of a clogged artery. So what's the now I'm drawing a blank. Now you see why he took over. What's they called your blocked carotid artery? That could be indication of that. So that's the only time you have to worry about it, really.
Does anybody have any other questions relating to this?
Not a question, but just an observation, because I do have tinnitus. But since wearing the hearing aids as of, I don't know, 3 years ago, maybe, I've noticed that, well, first of all, humongous improvement just in the hearing ability, period. But when I wear the hearing aids, I am just about never aware of my tinnitus. It's just gets lost in the noise and everything that I'm hearing. I never focus on it. It's almost as if it were gone. Now, if I think about it and focus on it, I can hear it. If I take the hearing aids off, of course, then it's a little more pronounced and I can be aware. It doesn't bother me at all, but I'm aware of it. But ever since wearing the hearing aids, effectively speaking, gone, because I'm unaware of it, even though it's there.
Fantastic. Now, when you take the devices out at the end of the night, you said you can hear it. Do you feel like that has changed in its quality, or even
No,
quantity?
and when I take it off, I have to, on occasion, I will hear it because it makes me aware of it. But most of the time, I can only hear it, even if I take it off, if I make myself aware of it. And
That's
then I can
fantastic.
hear it. Yeah.
It's always there, but when it's quiet is when you most notice it.
Yes. Yes. But the hearing aids have been fantastic in that sense for me.
Spread the word, brother. There's still a lot of non-believers out there.
Yeah.
But you got to do it right.
So when a patient comes in and has tinnitus, and you're trying to, I guess, compensate for it, you're not really looking to match the frequency that they are hearing constantly. You're supplying an additional frequency that basically trains the ear not to listen to the one.
So that is a very great question. And, we used to do some tinnitus matching, which would involve, like A/B comparisons of frequencies and, through the booth and certain tones. But what we found is that it's often, our testing equipment is often not specific enough to actually really hone in on that particular frequency. But what we find is that where most patients have a hearing loss or damage to their auditory cells is that where we have more hearing loss. So by treating the hearing loss effectively, what we're doing is essentially providing that same, frequency back, and we're measuring it via real ear measure here to make sure that we are matching prescriptive targets. Whereas some places just put them on your ear and ask you how it sounds. We have our specific real ear measurement tool, which allows us to look at the frequency response right in your ear to make sure that you're getting that. So by doing so, we can actually just go right on top of all of the areas where we have some damage or depletion, including the one that might be producing the stimulant or the tinnitus, and therefore treating it. For patients that don't have much hearing loss or any at all measurable, there's probably still the sign there of some auditory damage. It just is probably not affecting their actual sensitivity to sound yet, but it's more or less clarity. So by bringing back some extra stimulus on top of it and trying to fill in some of those blanks or produce stimulus over top, that we can actually help to quiet it as well. But that was a great question. Thank you for asking.
They're still trying to figure that out. There's whole businesses, whole companies focusing on that. They have research monies, and it's one of the most complex things to try to resolve. But if the hearing aid, not only does it help you hear better, but we have a 70% chance that it covered up. And guess what? If it doesn't, there's also a tinnitus masker that you can add to it. And it's just a little bit of noise. And I don't know why you don't notice it, but you just kind of increase it till the person detects a change in the quality, not the quality or loudness of the tinnitus. And then after a few weeks, it helps to mask it. So those are the best things to do. A lot of people come in, they want the psychological training and all that, but it's pretty involved. And usually we can handle it just with optimizing their hearing treatment. I want to say hi to, hey, Uncle Cheryl, I see you're on. Lives in Fort Wayne.
Any questions from anyone else?
No, all good for me.
Wow, nice job. You guys got the scientific approach to it. I'm more simple.
Well, it was nice to have your explanation. So thanks for joining us.
He usually tells me to be quiet, but I'm
Well, you can
teasing.
be a
I'm
little bit more
teasing.
professional with patients than in our other meetings.
I, for one, am glad both of you are here.
Well, thank you, sir.
Thank you. We appreciate that. And we're glad you're here. I wish I would have thought of these things, man. So it's
Well,
time for a change in command.
But we're here to help. So thanks everybody for coming. If you need an appointment or have more questions, you can email us, you can call us. We're here to help with your hearing needs, to make sure your hearing is best as possible. And that, we take care of any issues that you might have, but feel free to reach out. There's a phone number there for an appointment. Thanks everybody for coming today.
I think we have a question. Is that right? Is that on the next slide?
Oh, yeah. So I forgot about that. I did not rehearse this as much as I should have. Let's see if I can figure out how to do this poll again.
I bet everybody could just answer. If you don't mind, we just want to know if you'd be willing to, interested in attending again. If not, that's no, he won't take offense to it. If so, what are some of the topics you might like to hear about?
And also,
Very interested. You choose.
also, if you could spread the word too, I think, and we just love what we do. We like to share it, and we want to, you have to figure out what your purpose in life is. Ours is to help people make life a little better through better hearing. And we enjoy this. It's great that you guys are here, and so we feel like we're doing something useful.
If you need help, the mute button is, if you take your mouse down to the bottom left, there'll be a little microphone button and just click on that. Okay, you typed very interested. Cool.
Issue.
Yeah.
How do they know?
You got it.
How do they know it's you?
Well, speaking for myself, I'll tell you, yes, I'm always interested in these things. I'm particularly interested in the technology of the hearing aids themselves, the advances in the hearing aid technology. And I'm always interested in these topics because I have experienced hearing loss and do have tinnitus. So the hearing aids have been fantastic, helping me out. And so in future events of dialogue like this, I'll be very interested in attending. Yes.
Awesome.
That's
you.
an excellent topic. It is so unbelievable, and all the specialties that go into making a hearing aid. Neuroscientists, you have artificial intelligence people, you have the software people, it is just unbelievable. The new ones do 80 million calculations every hour, and they give you the best signal noise ratio possible, according to the latest technology. And I joke with everyone, I've been doing this 44 years. I said, now people even think I know what I'm doing. So
Yeah, it's fascinating. I enjoy it, and I look forward to learning more as we go along.
Very good.
thanks. Someone pounded my window. I'll see y'all. Thank you.
All right, so we'll get together another one and we'll send out the information and make sure everybody's got invites again. And that's all for today. Thanks a lot for coming.
Thank you, doctor.
Have a great day.
Bye-bye, all of you.
Bye-bye.